Oh my God! You know I'm gonna giggle throughout all of this. You do understand?
Fine. I love it. We're going to talk through the top 5 treatments that you recommend that you do at the clinic.
Do not suddenly think that you need to change yourself and run into doctors and run into beauticians, estheticians, whatever, and start getting Botox fillers. No. So this is my number 1 advice, especially if you've never done it before. The fact that you found something on Instagram or on Google, or when you were not liking your reflection in the mirror, you were like, oh, no. So have a consultation, have a virtual consultation. Majority of the doctors now are doing virtual consultations. Calm down. Okay, so let's get on with it. One concern that we've all been having during the lockdown, the hands. With all the gel sanitizers, and we're going to be continuing, don't forget that even after lockdown, you will still have to have good hand hygiene. And what it does, really dries up. And there's been a lot of eczema, a lot of hand rashes, a lot of dry skin on the hands. Now, there's some tricks that you can do at home, but when you're going to go back into the clinic, this is going to be my number 1 treatment for hands. And I have a box of this at home. It's called PROFHILO. And it is almost like a liquid well, it is an injection. It's not very scary because it's only 5 injections on one hand and 5 injections on another. But this is hyaluronic acid. And if you know the word hyaluronic acid, that is like a rehydrating acid. It is a naturally occurring substance, so your body has naturally hyaluronic acid. So we're just basically giving it like a boost, a hydrating boost. And rather than using it in a cream, we are injecting, because we're doctors, we like injection, we are injecting it in the skin. It spreads into your skin and hydrates the entire hand, rejuvenates, promotes collagen
Production.
Good girl. Collagen production, but hydration is key.
How long would those results last? Somebody's asked. Like,
so the course is usually 2 treatments, about 4 to 6 weeks apart. And the results then last for the next 3-6 months. Because not only does it give you that instant hydration, it also stimulates your own body into producing new collagen. So that is important. Number 2 concern, and not a single person is lifting their screens to prevent the tech neck. So the tech neck, or us doing this with your phone, when you're on your phone, when you're on your iPad, that thing is happening. So the simple trick for you to do at home to make sure that you pick up your device higher. Don't
just
do
be
that.
more aware of that, because I like see a lot. Even when you're reading your books on the sofa and you're kind of like low,
yeah,
it's like everything's hanging down, gravity's fight. You know,
so
you want to just kind of like just be like.
Yeah.
Like you're on holiday.
A lot of my patients I notice in jowls and the neck. So the best treatment for that is ULTRACEL Q+. Now that is ultrasound stimulation of collagen. Again, it's almost called non-invasive facelift. So make sure that A, you are not making the situation worse by holding your device low and kind of creating this. And secondly, the jowls can be lifted with non-invasive technology. So the one I prefer for the lower face, which includes the neck, the jowls, is the ULTRACEL Q+. Again, ultrasound energy stimulates your own body into producing new collagen. It almost rejuvenates your body. It's almost like a zip, get back into action. Because your cells called fibroblasts are non-active after about the age of 24. So what energy devices do, they almost penetrate into the layer of the skin where the fibroblasts are. And they kind of like, hello.
Wake up.
Exactly.
Yeah.
We are going to create an environment, usually it's thermal, so increase of the temperature. We're going to create an environment for you to wake up. Of course, going into clinic, you are using much more. So as a doctor, I use medical grade technology, which is probably the strongest, which is ULTRACEL Q+, is a medical grade ultrasound, non-invasive skin lift. Another one that I am very passionate about, my number 3, is actually one of my patients who made me completely change my idea about urinary incontinence. But she was 21. She was a young little girl who just gave birth because genetically it runs in her family, and both her mother and her sister suffered their whole life. After pregnancy, they had incontinence. She saw that it was normal. Funny enough, she came to me for a hydrofacial, which is just a normal facial. And we were chit-chatting, and I was like, oh my God, and I jumped on this chair this morning, and she's like, what chair? So we started talking about it. And I realized it's okay to have weak pelvic floor at the age of 21. So I want to talk about incontinence. or prevention of incontinence. Pelvic floor muscle is the most important muscle for us girls and men as well, but I want to concentrate on ladies.
I'm squeezing now.
Good girl. This is the problem with squeezing. I'll be very honest with you. You'll be squeezing it for 2 minutes and then your mind will travel. You will never squeeze it for enough time unless you are deliberately trying to do it. I mean, I'm sorry to say, you don't know if you're squeezing the right thing. Like you sit in there squeezing and you're like, am I squeezing my butt? What am I squeezing? So the only actually at home, the only guaranteed way to squeeze it is to stop urinating midstream. That is the only way you know that you have medically done the right squeeze. EMSCULPT chair is the treatment I want to talk about. And that is, for the first time, a literal in-clinic treatment that looks like a chair. It literally looks like a chair, so you can sit on it. And the magnetic energy in the center of the chair will, no matter what you do...
Can I just say, because I have used this chair in the clinic.
It's weird.
And it's amazing though. So you have to kind of wiggle onto it and make sure you get right on the right spot.
It's called a happy chair for a reason. I've never got happy on it. Not a lot of my patients have, but some have. And the feedback...
It's not the use for it. It's to tighten your pelvic floor and prevent you from becoming incontinent.
Exactly. But you know what? It really improves sexual life. I'm sorry to say, but if you are more compact and everything is kind of tighter and in control, that's all I'm going to say. It is subjective. So if you don't really like your boyfriend, don't expect the chair to fix that. But the feedback being that it really improves that situation. But the idea is that even if you are, let's say, if your oops moments are not stopping you from life, even if it's not bad, you want to make sure it's not going to be bad in 10 years. Because
I think even if you haven't had children, which I haven't had children, as you get older, because of the hormonal changes in your body, unfortunately, it's gravity again and changes within your body that it just happens. And you have those moments when you're like, go quickly,
Or when you need to go to the toilet and you can't wait. That happens to me. I haven't had children. I'm 39 and I sometimes have moments or had moments before EMSELLA because now I'm so in control of it. We live in a society, and I'm sorry if I'm going to be saying and it's going to offend somebody. I don't care. We live in a society where on TV, big corporations are paying for advertising videos to say that it's okay to lick, that it's okay because they're advertising pads, incontinence pads. And women there in their prime, mid-30s, mid-40s, mid-50s, in their prime age, are saying that it's okay to lick. It is a muscle. It can be trained. It should be fixed. No woman should think, especially no 21-year-old woman or young woman or any age woman should think that there's nothing can be done. So there is obviously pelvic floor exercises, there's Pilates, there's special things that if you want kind of more holistic approach, please research that. If you want a faster, quicker, because EMSELLA chair half an hour is an equivalent to 11,000 Kegel exercise. I've never done 11,000 Kegel exercise in my life. I mean, I've tried Kegels because it was a problem for me. And I have to say, 2-3 sessions on the chair, I felt much more in control. And I know I'm almost like on an Instagram talking about incontinence, but we should be talking about it.
I know, and it shouldn't be taboo. It's like so many of my friends, like we just like that does happen, not in a massive way, but just in a way that you just start, that you just sort of think, oh, what I love about you is that you are hilarious, like because and just naturally you're just fucking bonkers, and I love that.
I love you.
So when I come to see you, it's just like we're hanging out and we're chatting, and then you've got all this knowledge and then you've got all these great machines. And so, and I like that we're talking about this because it is a bit of a taboo subject, and it shouldn't be.
Things can be done. It can be fixed. It can get better. So it's not that we're talking about something just for the sake of talking. We're raising awareness, and also we're raising awareness that there is a solution. You're going to sit at the chair. It's just a one button. We adjust the sensation. It's going to be weird for the first 2 minutes, but then you adjust, and there you are on your phone or reading a book or whatever you want to do for half an hour. Maybe just chill, meditate.
I just read a magazine. I just chill. Okay, so we've done hands, we've done jaw, we've done pelvic floor. Number 4.
Number 4 is EMSCULPT. EMSCULPT is the newest technology. And it is high-intensity electromagnetic energy that actually talks to your muscle directly. And it really makes it contract at a supramaximal level. What does it mean? It's a level beyond your human ability. So the way you exercise in the gym, or the way you exercise with a trainer, or even on your own with your Zoom class, is at kind of at your maximum level. Let's put it this way. Magnetic energy takes that level much higher. So your muscle actually grows by about 17%. So it really bulks up. But it also gets rid of a little bit of fat cells that surrounds the muscle, because basically muscle is hungry, works out too much, so it basically eats the fat surrounding it. But the most important thing is that once the muscle is exercised or contracted at that level, it remembers that output. So your exercise at home becomes so much more efficient because of the muscle memory. The muscle remembers how to exercise. And it is for the first time that an aesthetic doctor can say that this treatment not only will lift your bum, but also will make your muscle stronger. So there's a health benefit. So we can do it on the arms, on the abdomen, on the legs, basically anywhere. On the buttocks, back pain, really great for back pain because you have a stronger core.
They're like two paddles that you put onto the stomach and you strap it in. You turn it up, and so it's sort of.
Oh my God! Do I really talk this much all the time, Lisa?
All the time, the time. Like when I come to see you, I have to allow like an extra 2 hours just for chatting. What's the fifth one? I'm curious.
Yeah. Remember that fat freezing works. And that is the most important thing. So it's very, very important on how you position the applicators. So COOLSCULPTING and CRISTAL are my two preferred fat freezing machines. But it doesn't mean it's a weight loss treatment. It doesn't mean that you can go and eat as much banana breads as you want. It means that if you have that stubborn, won't go no matter how much you want it, then there is a solution. And then come see me and I will freeze it away.
The crystal is brilliant, and I've done it on my stomach. What it did psychologically to me was it made me want to be more healthy, to run more, to watch what I was eating. It wasn't like, oh, now I've done that, I don't need to do anything. It gave me that impetus to try and shed more fat. And it was just like it all went together.
You feel so motivated to get the best out of it. And that is the most important thing with all the treatments.
And it's not about getting rid of those sexy curves that you've got.
No, God, no.
We're all about body confidence. We want you to like feel fucking amazing, look amazing.
And you said the most important word that I want to finish on: body confidence. Love your body. Your body, especially during the pandemic. Say thank you to your body, carrying you through it. You're healthy. Your body helped you go through pandemic. You are not ill. So feel confident in the body that you have, because it's been amazing to you. So be amazing to your body. See the best in your body and concentrate on that. The other small little areas we can deal with, but love your body and be confident about it.